How can infectious diseases be effectively controlled? This presentation explores the assignment on infectious diseases for voluntary health workers overseas. Dive into the intricacies of pathogens, transmission, immunity, and medical control. The assignment carries 6 credits at Level 3. It requires a detailed booklet of 3,500 words. The focus is on infectious diseases and their control. The audience is voluntary health workers overseas. Assessment criteria range from 1.1 to 5.1. Only one formal submission is allowed. A resubmission is possible only if criteria are unmet. No draft reviews or pre-marking are permitted. Work must be independently produced. This ensures fairness and integrity. Attend tutorials and ask specific questions. Clarify command verbs like analyze and evaluate. Seek guidance on structure and referencing. Review grading descriptors carefully. Strong performance requires explicit coverage of assessment criteria. Use clear headings aligned with each assessment criterion. Include your own diagrams, tables, and charts. Provide relevant global examples. Use scientific terminology correctly. Ensure in-text references and a bibliography are included. Define what a pathogen is and classify the types. Explain structural adaptations that enable pathogenicity. Discuss virulence factors and replication mechanisms. Support your explanations with diagrams. This forms the basis of Learning Outcome 1. Explain the mechanisms of vector transmission. Use examples like malaria, dengue, and Lyme disease. Describe the biological interaction between vector and host. This is crucial for understanding disease spread. It aligns with Learning Outcome 2. Evaluate nonspecific defenses such as skin and inflammation. Phagocytosis is also a key component. Explain vaccination and artificial acquired immunity. Link these to global public health impacts. This covers Learning Outcome 3. Distinguish between passive and active immunity. A table is required for this comparison. Describe humoral and cell-mediated responses. Explain primary versus secondary immune responses. This is part of Learning Outcome 4. Evaluate the role of antibiotics, antivirals, and antifungals. Discuss their mechanisms of action. Explain antimicrobial resistance and its global implications. This is essential for Learning Outcome 5. Understanding these aspects is critical. Merit requires very good understanding and application. Distinction demands excellent depth and breadth of knowledge. Clear evaluation and global context are necessary. This standard assesses knowledge and understanding. It is crucial for high grades. Merit requires very good scientific reasoning and accuracy. Distinction needs excellent precision and insight. Strong application to immunology is essential. This standard evaluates subject-specific skills. It is key for achieving excellence. A logical booklet structure and presentation are necessary. Accurate scientific language is required. Independent research and correct referencing are crucial. A professional academic format is expected. This standard assesses transferable skills. Ensure all assessment criteria are explicitly addressed. The word count must be within 3,500. All diagrams should be original and labeled. A bibliography must be included. Academic integrity is paramount. Pathogens include bacteria, viruses, fungi, and parasites. Each has unique structural adaptations. These adaptations enable them to cause disease. Understanding these types is foundational. It aids in developing control strategies. Malaria is transmitted by Anopheles mosquitoes. Dengue spreads through Aedes mosquitoes. Lyme disease is carried by ticks. Each vector has unique interactions with its host. Understanding these examples is crucial for control. The skin acts as a physical barrier. Inflammation is a response to injury or infection. Phagocytosis involves engulfing pathogens. These components are part of non-specific defenses. They provide the first line of defense. Vaccination prevents the spread of infectious diseases. It provides artificial, acquired immunity. This has significant public health impacts globally. Vaccination campaigns reduce disease incidence. Understanding its impact is essential for health workers. Humoral response involves antibodies in body fluids. Cell-mediated response targets infected cells. Primary response occurs on first exposure. Secondary response is faster and stronger. These responses are key to specific immunity. Antimicrobial resistance is a growing concern. It reduces the effectiveness of drugs. Understanding resistance mechanisms is crucial. Global efforts are needed to combat this issue. Effective medical control is essential. You have now explored the control of infectious diseases. The assignment covers pathogens, immunity, and medical control. Understanding these areas is vital for voluntary health workers overseas.